Hi, I am Atiqa and I am from Group 23. My topic will be about demonstration of describing the rules of documentation in nursing surgery. As an introduction, nursing documentation is essential for good clinical communication. Appropriate documentation provides an accurate reflection of nursing assessments, changes in clinical state, care provided, and pertinent patient information to support the multidisciplinary team to deliver great care. Documentation also provides evidence of care and is an important professional and medical legal requirement of nursing practice. The aim of nursing documentation is to provide a structured and standardized approach to nursing documentation for inpatients. This will ensure consistent clinical communication processes. So we might find these terms in nursing documentation. Firstly, it's EMR, which means electronic medical record. Next is EMR review, which is the process of working through the EMR activities to collect pertinent patient details. Other than that, there's real time, which means nursing documentation entered in a timely manner throughout the shift. And lastly, required documentation, minimum documentation that is required to reflect safe patient care. On admission and at the commencement of each shift, all required documentation must be completed to comply with the National Safety and Quality Health Service standards. There is an expectation that shift required documentation is completed within 3 hours of shift start time. So here are the rules of documentation, starting with assess. In assess, there are EMR review and patient assessment. Next step is plan, in which plan care and review orders. After plan is implement, which is provide care and treatment and also diagnostic tests. And ending with evaluate, in which evaluate outcomes, interpret results, and assess compliance are applied in this step. Starting with the first step is assess. In assess, there are certain criterias. Firstly, it's storyboard, age, bed card, gender, FYIs, infections, allergies, isolations, LOS, and weight. There's also IP summary. In IP summary, there's medical problem list, treatment team, orders to be acknowledged. Next is Victor graph, which shows observations, trends, zone breaches. Then also has some notes, for example, admission, ward round, any other useful details. And next is results review, which shows recent and pending results in terms of time mark. There's also MAR, which is entails for overdue medications, discontinued, adjust due times for medications. We also have to include fluid balance, the input and output, and the balance. Another detail is avatar, in which lines are reviewed, the drains, airways, wounds, and including the location, size, date inserted, and also orders. In orders, we have to review all active, continuous PRN and scheduled, and also discontinue expired. Nursing orders create and manage as required for patient care. Lastly are the flow sheets. Flow sheets are document specific. We have to document specific information. Last filed will show most recent entries. We have to arrange in that manner. And we have to review and manage unnecessary rows. For example, complete, meaning we don't have to review that file again. The next step after assess is plan. With the information gathered from the start of shift assessment, the plan of care can be developed in collaboration with the patient and family or carers to ensure clear expectations of care. The following includes abnormal assessment, for example, uncontrolled pain, tachycardic, increased WOB, poor perfusion, hypotensive, febrile, etc. Next is change in clinical state, for example, deterioration, improvements, neurological status, desaturation, and so on. We also have to include adverse findings or events, for example, intravenous painful, inflamed or leaking requiring removal, vomiting, rash, incontinence, fall, pressure injury, wound infection, drain losses, electrolyte imbalance, plus or minus fluid balance, and so on. We also have to consider patient outcomes after interventions, for example, dressing changes, pain management, mobilization, hygiene, overall improvements, and also responses to care. And next part is family-centered care, in which parent level of understanding, participation in care, child-family interactions, welfare issues, visiting arrangements, and so on are considered in this category. And lastly are social issues, for example, accommodation, travel, financial, legal, and so on. After planning, we have to implement and evaluate. Progress note entries should not simply list tasks or events, but provide information about what occurred, consider why, and include details of the impact, outcome, and plan for the patient and family. All entries should be accurate and relevant to the individual patient. Non-specific information such as ongoing management is not useful. We should avoid duplication, which are statements about information recorded in other activities on the EMR which are not useful, for example, medications given as per MER. Professional nursing language should be used for all entries. Abbreviations should be used minimally and must be consistent with RCH standards. For example, emotional support was provided to patient and family could be documented instead of TLC was given. So use words that are not abbreviated. Real-time notes should be signed off after the first entry and subsequent entries are entered as addendums. So here is an example of real-time progress note entry. At 9:40 a.m. nursing, Billy is describing increasing pain in left leg. FLACC is 7/10, paracetamol given, heat pack applied with some effect. Education given to mom at the bedside on utilizing heat pack in conjunction with regular analgesia. Continue pain score with observations with the progress note signed at the end. At 10:15 nursing, episode of urinary incontinence. Billy is quite embarrassed and urine bottle is given in bracket addendum. And at 14:30 nursing, routine bloods for IV therapy is taken. Lab called with high potassium ions, hemolyzed. Medical staff notified. Repeat bloods in 6/24. Encourage oral fluids and diet if tolerated. IV can be removed in bracket addendum. That is the end of this video. Thank you for listening.